The current event I'm going to be talking about today is from U.S. News. It is the Texas top court. They won't guarantee right to abortion in complicated pregnancies. In May of this year, the Texas Supreme Court failed to protect providers who perform abortions in complicated pregnancies from legal penalties. 22 lawsuits were filed by patients and providers regarding this issue, and all of them were rejected. The medical exemptions to abortion ban remain unclear, leaving healthcare providers reluctant to provide necessary abortions in fear of legal penalties. The primary bioethical principles being threatened here are autonomy, beneficence, and non-maleficence. Autonomy is one's ability to make his or her own rational and moral decisions. Beneficence, to do what is best for the patient. And non-maleficence, which is the principle that obliges us as a provider to do no harm to the patient. The main bioethical dilemma here is between non-maleficence and beneficence, because as a provider, you find yourself in a sticky situation. On one hand, it's your duty to provide the best care to your patient and to prevent any harm. But on the other hand, they are constrained by the vagueness of the state abortion guidelines, which makes them hesitant to perform these medically necessary abortions in fear of legal repercussions. One of the plaintiffs, her name is Amanda Zarowski. Amanda was 18 weeks pregnant when her water broke and the baby was not viable. Instead of inducing labor and aborting the baby quickly, they had to wait until the baby's heart completely stopped. This delayed care, and which led to sepsis and multiple days in the intensive care unit. The importance of this event to me and my profession. While this ruling directly affects the way I as a provider provide care to my patients, the main issues that a provider may encounter are legal risks and vagueness, medical ethics, and personal ethics. So legal risk and vagueness. The way the state abortion law is written is so unclear when it comes to medically necessary abortions for life-threatening conditions. Like I said before, it's left doctors unsure and scared of getting penalized or even prosecuted, which ends up delaying care and putting their patients' lives in danger and at risk. Medical ethics. As a provider, our main duty is to put our best patients' interests first. But when the fear of legal repercussions start to cloud our medical judgment, it becomes impossible to truly meet that responsibility. Personal ethics. As both a provider and a human being, I have my own morals and obligations, but when I start putting my own interests above my patients, those values are seriously at risk. Some relevant provisions from the Code of Ethics for Nursing being violated here are Provision 1, respect for human dignity, Provision 2, prioritizing patients' best interests, and Provision 3, patient advocacy. These are all being violated. As nurses and providers, we provide non-judgmental and compassionate care to every single patient we encounter. And I believe nurses are the main advocates for their patients because they're with them for 12 hours a day. And this care and advocacy for the patient may be hindered due to these legal restrictions. We are unable to put the patient's best interests first due to these legal concerns or constraints. Implications for healthcare professionals. Care accessibility and patient safety. Increase in maternal deaths and severe health complications, increased strain on the healthcare system, and inadequate medical education, and an increased shortage of healthcare providers. So first, let's talk about care accessibility and patient safety. So many women will be forced to go out of state for abortion access, and this will lead to delayed care for sure, and that directly impacts patient safety, of course. Look at Amanda Zarowski, right? Increase in maternal deaths and severe health complications. I'm going to piggyback on basically patient safety. Severe health complications and maternal deaths may begin to increase due to delayed care. Women from low-income backgrounds are at greater risk for deteriorating maternal health because they may not be able to afford to travel out of state to get the procedures necessary to, you know, to help prevent further health complications. The next one would be increased strain on the healthcare system. So this delayed maternal care leads to severe complications, leading to more emergency room visits and resources, costing the state and the healthcare systems more money. And the last one is inadequate medical education and an increased shortage of healthcare providers. So this law may impact the training and education given and necessary to care for patients with high risk pregnancy complications, which reduces the quality of care provided. Healthcare workers may seek education and employment elsewhere, causing an even greater shortage of healthcare staff. So in conclusion, this issue has serious consequences for patient safety, access to healthcare, legal responsibilities, and ethical standards in the medical profession. Without clear guidelines and legal protections for necessary abortions, healthcare providers may face greater risks, which could lead to poorer health outcomes for mothers, especially those in vulnerable situations. The ongoing legal disputes and discussions about abortion laws will keep influencing the healthcare landscape, making this a constantly changing and controversial topic in the public health. Thank you.